help me understand some of the misconceptions of TMS. Somebody who's thinking about doing, and actually I read this a lot on the forums, and people just asking, is there anything I should be afraid of prior to doing TMS? Oh my goodness, I got my first appointment set, and you can hear it in their writing, how afraid they are. What are some of the things that you're seeing?
I think there's a lot of misconceptions of, first of all, the risk factors for TMS, right? I think people don't appreciate that TMS has been around since the mid 1980s. It is not a new technology. It's hard to hear, this, I think, not to mean to be a disservice, but I think a lot of people that are talking about it to get the hype up are like, oh, this innovative technology, this really new treatment.
Yeah.
Doesn't help us, right?
That's, you know what? I never thought about that one. The new treatment. It's nothing new about this.
Nothing new, right? So I let people know, listen, this is a tool. It's a tool that we have had for over 30 years, almost 40 years in medicine. And it's become a treatment when we've learned where to apply it on the brain, what pulse protocols to use, what to focus on when we've learned more about illnesses and sort of, neuro circuits and sort of neuro tracks in general. But so I think, a misconception is really just how safe is it? And understandably, right? We get afraid when you are dealing with the brain, the heart, the eye, right? Big organs. So I think that it's truly a really, really safe treatment. And I don't think people understand that enough.
Yeah.
We're not putting anything into the brain, right? We are just optimizing the functioning that's there.
Exactly.
People can understand that is really important. And to me, that's a big safety thing. That we do TMS on children, right? We do TMS on children 3 and up. Like that shows you how safe it is and how beneficial and how important we know to get in early intervention. I think there's mistakes about risk of seizure. Right. When TMS first came out, I think there were some seizures, pretty much user error were most of them.
And that's something I do want to get into.
Yeah.
But thank you for touching on that. Last time we spoke, your lack of concern with seizures was fascinating to me, and I enjoyed it so much. Yeah. And it's something that you've never dealt with. You've dealt with.
Still no. We have 11 sites. I think our latest, we weren't keeping track until about 2017, but we've done over 150,000 sessions and have not had one seizure.
Yeah. That's what I told you last time too. Knock on some stuff. I'm gonna go with my head.
And people who have, people who have epilepsy, who have seizure disorder, are allowed to do TMS, right? As long as they're stable with their seizure. It's really not a risk. Really big misunderstanding. The other big one is ECT, right? People confuse it a lot with electroconvulsive therapy, right? Is when we really use electricity and we induce a seizure. And even that is, I think, less scary for people than the fact that there's cognitive impairment, there's general anesthesia, it interrupts their day, right? They have to be on disability. They can't drive themselves to and from.
Yeah.
So TMS is completely different from that, right? No cognitive impairment, right? No interruption in your day, fully alert and awake, right? No anesthesia. I
drove an hour down south every day, every morning. I would drive an hour there. I'd drive an hour home. And I was to work at 9:30 in the morning.
Okay. There you go.
Worked a full day, no problems, It's safe.
Very safe. Very safe.
And people are concerned, and I get it, right? You're messing with my brain.
Right.
And I do, if anybody understands that one, it is me.
Yeah.
I did own a TMS chair before I got in it.
Yeah.
And I still wasn't going to get in that chair. So I totally understand.
Yeah.
But one of the first things I said to myself once I finally was in the chair, I was like, man, that was stupid.
Yeah.
Why did I wait so long to do this? This is amazing.
Yeah. Well, I say when I first opened my TMS practice too, I didn't tell any of my colleagues that I had TMS practice. I didn't even tell my own patients, right? I was treating other people's patients because it is a little, like, does it really work? Like, and I want to make sure it's working and, but yeah, that was 2008. So years and years ago and no doubt in my mind, very efficacious, very safe, really well tolerated.
So I've given it to my 5-year-old son for sleep.
See?
Boy wouldn't sleep through the night for anything. Gave him TMS. Forget about it, right? My 9-year-old daughter, she was 9 at the time. TMS. and life is so much different. There is a there was a patient that we actually share, came here, I think she did 40 with me. I think she did 40 sessions with me. Gorgeous girl, bad story. And that's just one thing I remembered about her was her backstory was rough. Kid had a rough upbringing and a traumatic event that I shared with her because it was similar to some of mine. And we gave her her sessions. She was doing well, and she called me and she told me that she felt so good. Kyle, I'm gonna move to Santa Monica. And I said, that's amazing. Well, tell me, Kyle, I'm gonna go back to school. And my heart just melted because she had dropped out of school. She had truly struggled, attention deficit disorder, the trauma, the PTSD, all these things, right? She told me she wanted to go back to school. And Kyle, I want to work at a TMS clinic. And I said, like, how cool is this, man? I got somebody I know that I want to introduce you to. And again, shot you a little text. And she called me back. And she told me that she had met the amazing Martha Koo and that she was going to go to work.
Of course.
And if that isn't the perfect story of TMS success, I don't know what is. You know,
best testimony, right? People that go through it, they're able to change their lives. It's been so impactful that they want to be able to share it with others.
Yes.
And that's when it's the best testimony. So talk about fearful, right? Coming is what we often do for patients too. I'm like, hey, you can, I have 10 people you could call that went through TMS.
Yeah.
They're happy to talk to you. Right? I think a lot of times patients, they certainly would rather hear it, right, from a patient than just from us, right? Which makes sense, right?
Yeah.
Talk about the trust, right? And maybe comfort asking different questions.
You're just a
too.
Doctor. You're going to tell me,
right? Of course you want me to come, right?
And just the trust factor in doctors today in the first place. Right. But then you've got this magic machine, right? That you own.
Right.
So there is that, right? And that's one reason I do love this channel. I'm not a doctor. I'm never going to pretend to be a doctor or even pretend that I'm smart. But I know that through my journey with TMS, I was blessed to be able to sit with a microphone and talk. And trust me, that's a learned skill. It took a while to get here. But being able to share my message. This is how I do it, right? Yeah. And the safety, I get the concern. If anybody understands the concern, it is me. But the one was 2008.
Yes.
You opened your first clinic.
All those treatments never had a negative outcome in the sense of a medical issue. Never.
What about going through treatment? Often you hear about the dip.
Right.
Right. And Dr. Ian Cook gave me this one. Kyle, we don't get better in a straight line. And the way he said it to me, now, I was like, all right, I'm not dumb. Jeez. But he was like, no, we don't get better in a straight line. And tell me how you manage the dip, how you talk about the dip with people. Yeah. Let's discuss that a little bit because I think that one's so important.
Really important discussion. I think one part of the dip we're referring to is that often people will be getting better and then maybe after 2 or between 2 and 4 weeks, right, they feel a little bit of a dip and then there can be some anxiety that comes with that. Oh my gosh, I thought this was working. Now it's not working.
Yeah.
And so we do talk about that with patients because I think, being prepared is one of the best things you can do, right? Once again, setting expectations, letting them know that we see this sometimes, not with everybody. It's not unusual. It doesn't mean the treatment's not working. So literally just education. What I truly think it's about is I think that people come in feeling really poorly and there is a huge leap of improvement in the first few weeks. And then it's like we're back into our lives, right? And a little bit, maybe some of that honeymoon phase is over and helping patients understand the difference between, like you say, like being not depressed isn't the same as being happy. You're not going to wake up every day and feel fabulous. Things happen. And we hope not, right? You should have your normal emotions.
Life happens.
Yeah, life happens.
Right?
And so I think some of the dip might be, okay, now I'm back in my life, right? And let's really look. Some of the dip is, I think, really a sign of progress. Things that they weren't able to deal with or notice or feel before, all of a sudden they're feeling. And so it's not, I think a dip is even really I wish we named it something like just increased awareness, right?
Right? Something not so negative.
Not so negative, right? Yeah. Just like, wow, you're coming, you're present. Like maybe we should increase presence versus dip, right?
Well, if you're dipping, that means you've been improving.
That's
in my opinion.
Well, there you go. Well,
if you, that means you've improved, which shows that the TMS is working.
That's right. No, that's a really good. I never thought about that. I'm going to use that one. Right. That was like when I know we were talking about when patients would come back to me and they would be all better. I don't know, 7-8 months would go by, sometimes a year and a half. And they'd be worried like, well, what if I need TMS again? I'm like, well, that's actually a really good thing, because if you need TMS again, it worked.
Right.
It worked for a long time.
Right.
And you can do it again. Right? It's not a bad thing.
And insurance will cover it.
And insurance will cover it. Yeah.
How do we know, or how are you recommending the patients that are going to need TMS again? How do you decipher which patients should do maintenance?
Right.
Let's talk a little bit about that.
That's good. I think as a field, right, we wish everybody could have maintenance, because I think we know, right? And I think we also know that they would have less treatments probably overall throughout the year, right?
Yeah.
There's studies that show that. I think right now we're a little in the dilemma with the insurance, right? Insurance only covers acute episodes. It doesn't cover maintenance. So our practice primarily is insurance-based. So in general, if I'm going with treating the patients where they're at and what they can do in terms of accessibility and care, we are doing acute episodes where you reach out to them every month or every 3 months. We're checking in. If we notice, right, that they're starting to dip, then we'll, make a recommendation that they come back in. So the best we do in terms of the maintenance there is getting in early, right? We know the longer somebody's depressed, the harder it is to get them out of it. Getting them better at awareness of when, this is the start of a depressive episode. If I had my druthers and it could really be all clinical decisions, then I think that what I would love to see is everybody, first of all, we don't stop at 36 or 38. Right. We get everybody into remission.
Why is that?
Right. Well, we stop that because of insurance, right? That's what insurance covers, right?
Why?
Well, initial studies, right, were based on that. So,
and when were those studies done?
Yeah, way back in 2006, so even earlier, right? But real publications, 2006, 2008. So, unfortunately, we're stuck a little bit with that insurance model, but I think clinically, the right thing to do clinically would be to get somebody into remission. Some people, like you say, need 40.
Yeah.
Right. And then slowly be tapering it down. Once again, this is an evidence base, so we don't know, but I think it sort of makes sense, right? Like you don't go to the gym and get all in shape and then stop going to the gym.
Yeah.
Right. But you don't need to go to the same amount.
And you're going to just sit there in that wonderful shape for how long?
Not very long.
Right.
I bet people could do, you have to personalize it, but I bet people could do really well with like monthly sessions. Some people might need weekly, or you just put a few extra in there. If they're, if you have it, that would be ideal. So I do think we're moving that direction. I think there's always an interplay between the evidence base, the studies, clinically what's appropriate, and the insurance companies really looking at what's the best way to serve people. And I'm hoping we'll get there.
I have a patient, and actually I saw him today. And actually, I want to ask you this, but let me tell you this real fast. It was a gentleman. He's been here 4 times. And I love this place because I can walk in, and if I see their name, my girls will write their names on their board. So when I walk by, I just see the name. I know who's in there. I open the door. I know exactly where you're at in your treatment, right? Yeah. How are we doing today? It's nice to see you. Oh yeah, man. Hey, I slept so good last night. It's one of my favorite things to hear, especially that early, right? And he was like, Kyle, I got to tell you, I was 100% skeptic on this. Didn't believe you. And this guy, he's part of a marketing group or a networking group that I'm a part of. Okay. And that's how he heard of TMS for the very first time, is me going up and saying what I say. Kyle, I can already tell. He's like, not only did I sleep better, I got up and I worked out. And he's a very in shape guy in the first place, but he's like, I worked out and it was such a better feeling 4 sessions in, right? you know you got a winner.
Yeah. The sleep, you hit on a big one. I think sleep is one of almost the very first things we have. Yeah, I had a patient just last week who started literally after 2 sessions. So one, I think we love all our patients, right?
Yes.
If you don't love your patients, there's something going on, right?
Yeah,
But amazing guy, and sad story, exceptional basketball player, had lumbar spine injury, ended up on Suboxone for years, which he feels strongly like just plummeted him into an awful depression that he's off Suboxone now, but could never really get out of. But sleep also could not sleep at all. He comes with us. He does 2, and I see him day 3. How's it going? Same thing. I slept last night so well. I mean, he was blown away.
Yeah.
Right. Also very skeptical, right? When you, once again, I mean, a lot of the patients like that we see, right? Because they've gone through years of, I know, me too, right? We get to prove I'm wrong.
That's my favorite patient.
But they've gone through years of treatments or being told things that really end up not working for them. So of course they're skeptical.
Right.
Yeah.
And that's, like I said, that's my favorite type to work with. I love them all. But especially when they tell me, I was so skeptic of this prior, but look at this now. Like, you just get to sit here and watch people go through this every day, Kyle. And I'm like, yes. It's the best thing of my day is, I get to see this every single day.
We should do a study on how many people finish TMS and become TMS technicians.
Oh my goodness.
I bet it's a lot. We've had a lot.
I mean,
right? Or work in the field or something,
I became
right?
owners. So. I'm pretty sure. I would imagine it's a lot. I mean, but similar to the rehab industry, right?
Right.
How many people go through rehab and then open a rehab, work at a rehab, right? Become a therapist, counselor, whatever it may be. Yeah. Those numbers are large. Bernard. So I would imagine, and TMS, in my opinion, is such a higher level. You know, the young lady I was speaking of, she, couldn't wait to work at a TMS clinic, and now she does. And it's the best part of life, man. Do you see any correlation between men and women doing TMS, benefit-wise? Or does that fall right under a brain is a brain is a brain?
You mean who is one sex assigned at birth group get better than the other?
Yeah.
Do I?
Yeah.
I don't. Okay. I don't. We see more women. I think it's just the prevalence of maybe more women come in acknowledging depression. I don't know, or maybe it's the stats. But in terms of our outcomes, we get equally great outcomes for men and women. A brain is a brain.
Yeah. That's a running joke in my office because I do only have women that work here.
Yeah.
And they see me, and they're always, even my wife.
Yeah.
My wife for a long time, she's a stay-at-home mom, and she sees me and she's like, "God, why TMS do all this for you, and it doesn't do it for me?" Like, baby, you don't see the benefits, but I see the benefits. It's changed so many lives, and even my girls here, they play with me a lot. And so they'd be mad if I didn't ask you that question.
I see great results across the board, right? No gender differences. And I'm not sure I agree a brain is a brain is a brain.
Okay, fair.
But I do think, I'd say it as TMS works on that brain and that brain and that brain.
There you go.
How about that?
I like it. Good. I like that.
Good.
I accept that. Any differences in manufacturers?
In terms of the devices?
Mm-hmm.
Yeah, I think, we've seen a flood of TMS devices come out on the stage now. And I think there's distinct differences in user friendliness. I guess for me, I'm a relational person. So to me, I think part of the reason I use MagVenture. I love MagVenture. I'm not saying MagVenture is better than any of the other devices, but I have a relationship with them, and their device is great for me. They're always responsive to me. I've had great success with their devices. They stay on top of the field in the sense of FDA clearances and different types of technology, right? So I think that if you're not doing TMS, there are some things, right, to think about when you go to a site, like if you've never done TMS, right?
And that's kind of the reason for the question, right? Because people watching this probably have no clue who MagVenture is,
right?
who NeuroStar, Apollo, MagStim, what
Right.
any of these things are.
Right.
Right?
Right.
Do you only own MagVentures?
I've owned other ones.
Okay.
I had
Oh,
NeuroStar
that's right. You've
and
done
I had
NeuroStar.
BrainSway, and
That's
so
right.
I've owned a lot. But currently in our company, right, and partly that's because it's nice to have the same. When we're looking at like different sites,
Yeah.
to have the same device.
Have the same device.
So yeah, we only use MagVenture right
Okay.
now. Yeah.
Okay. You haven't seen a decrease in results from one chair to another, and there's no.
No.
Yeah.
No, I haven't. It's been great. Yeah.
Now, like I said, a brain is a brain is a brain. Is TMS is TMS is TMS.
I think not. I think this is where it gets to, right, experience of the user,
There you
right?
go.
Obviously, it's really important to know
Mhm.
how you're calibrating,
Mhm.
choosing, doing that right, how you're placing the coil, making
Mhm.
sure, how you're watching the coil placement throughout, right? We have the squirmy patients and we have the patients that sit very still.
Yes.
And like we said, I think from when you when you make the first call for your TMS appointment, I think it starts there, right? Like any
Mhm.
treatment, and how were you received, and when you show up, what's the feel of the place? You're going to be spending a lot of time there, right? I
Yeah.
mean, like your office is amazing, right? It's very welcoming, it's very warm, it's comfortable, right? It's not clinical and cold, and I think
Yeah.
that's really important.
Yeah.
But yeah, I think people going to do TMS for the first time, they should ask what device, right? Because there are
Mhm.
devices that have been around a lot longer. There's devices that get their clearances just based on, sort of non-inferiority,
Uh-huh.
which is different. I think how long the person's been in practice, what their hours are. Right? How easy? I mean, look, we do sites like you're parking super easy. You drive up, you're going somewhere every day. You
So
don't want to have to spend,
So
all right,
important.
where are my quarters for the meter,
Yeah.
right? Oh my God.
Oh my goodness.
So I think those are all really good,
Walk out and you
things
have a
that-
ticket on your car.
I
Like,
know. I know.
man.
So-
No, those things are super important. I thank you for saying that. And those are things that people should definitely be taking note of. And I like that you said, like, from the very first call, most of the patients that we treat
Right.
are in crisis.
Yes.
Rarely am I treating somebody for peak performance, is how I
Right.
put that.
Right.
Rarely. I
Right.
love those ones,
Yeah.
but that's barely ever the case.
Right. Right.
Is it the same
Can
for
you
you?
imagine calling? Yeah. And can you imagine calling? Like, how many patients do you hear from that say, like, they called 5 people and they didn't even call them back?
Oh, I get that one.
Yeah.
We get, luckily,
right?
so
Really
for
sad.
me, we
Yeah.
have one other treatment center here.
Right. Right.
There's one, and I'm not going to say their name because
Okay.
you
Right.
would know them.
Right.
And then we'll start a whole new clip. And that's not the purpose of this. But no, that's one thing with my staff. Like, my girls know.
Yeah, you pick up the phone, you call them back right away. They're in need, right?
Yes.
And you spend some time with them on the phone and answer their questions, right? Because that's so important. Right?
Yes.
It's not like calling and just saying, whatever, I want to come over. Do you have, I don't know, toothpaste on your shelf? I'm going to buy toothpaste, right?
Do you have this in
Like,
stock
there's
currently?
questions, yeah. And I
take
think
your
sort of being
time. Take your time. You sit there all day.
Right.
I will pick up the phone in my office.
Mhm.
If you're on that call, don't ever feel like you need to rush somebody off the phone.
Right.
Yeah. Simple things, but there are, in my opinion, there are lives on the line.
Invaluable. Yeah.
Sometimes people do bad things
Right.
when they can't get appropriate care, and when it's taken too long.
Yeah.
So that's why those things are.
I had a
super
patient,
important to me.
you just reminded me, someone I hadn't thought of in a long time, but a patient who I still stay in touch with him. I haven't treated me, maybe he came 5 years ago, but he called me one day, really having a hard time, wanted to come in, like, I think at 7:30 to get his treatment. And I was like, sure, I go over, I open the office, do the treatment. And it wasn't until like a couple months later that he told me, I was going to kill myself that day. Like, I literally, if you hadn't picked up the phone, right, and of course didn't, there's a lot of, I think a lot of shame and anxiety around that. Didn't tell me at the time, right? I knew he was really struggling, but there's something like, you pick up the phone, we have a gut sense, right? There's something there. It was just like, yeah, like sure, I'll come back to the office and treat you at 7:30 at night or whatever. And yeah, that's sometimes the result. And I will never forget that, right? That you never should feel whatever, too busy or too big or whatever, right? To not
Too big. Like, come on. And you're big.
Yeah.
And you're big, you know?
Yeah.
But again, that goes right back to the personalized care that you offer people.
Yeah. Important.
And the company that you've built is there to do that. And I love that so much.
Thank you.
It's so important.